All for joining us today for our Demystifying Medicare series. This series is entitled What Every Employer Needs to Know uh, for Medicare Open Enrollment, and we are thrilled that you could be with us today. Before I hand it over to our speaker, just a few housekeeping items. If you have any questions, please submit them using the Q&A function and use the chat to share any resources. Let us know where you're dialing in from, your name, your organization. We are recording this session, and yes, we will share these slides after we wrap today, if it at 3, if not sooner. And so you will receive these slides. Yes, and the session is being recorded. We're so thrilled that you guys could be here with us. We want to thank all of our partners for making this series possible. To name a few, thank you to WIP, thank you to NGLCC, NMSDC, NextGen. We'd like to thank When Purpose Meets Destiny Staffing, the National Hispanic Pastors Alliance, NABO, Renee's, thank you all, the NextGen Chamber of Commerce. We could not have made this series possible without your support and your amplification. I'd also like to thank the lab at Concord as well for being an excellent partner in helping us to promote this series. With that said, I would like to introduce our speaker, Xavier Vaughn. He serves as now the Senior Program Manager of Medicare Education. He hails from Missouri. He is an excellent baker, an excellent colleague. And with that, Xavier, over to you.
Thank you, Ashley, and I hope everyone's having a great afternoon or morning, depending on where you're dialing in from. And Medicare is something that unites us all. Whether we're someone who goes through it for ourselves, or we're a caregiver for someone, it's something that we all need to have a basic understanding of knowing because it's going to impact us at one time or another. And so today we're going to go over some Medicare basics, educating your employees on what they need to know and what you also need to know, and what resources and tools are available for you can disseminate within your organization. So what are some of the common questions we get surrounding Medicare? What is Medicare? What's covered? What's the difference between Medicare and Medicaid? When should I enroll into Medicare? What happens if I don't? And how will Medicare work with my existing healthcare coverage? So your role as a business owner is to provide Medicare eligible employees with educational materials that is from a credible source, connecting employees with unbiased sources of information, and help Medicare eligible employees avoid late enrollment penalties and help navigate the complex world that is Medicare. So what is Medicare? Medicare is a federal health insurance program for those who are age 65 and up, under age 65 with certain disabilities, any age with end-stage renal disease, and if you have ALS. It is important to know that if you are 65 and already collecting Social Security, or you enroll through having a disability, then that will be automatic. Those people will be automatically enrolled. If you're still working, not collecting Social Security, have end-stage renal disease or ALS, then you actively have to enroll into Medicare. And if you have end-stage renal disease, then if you're receiving dialysis for a month at home or 3 months at a dialysis clinic, then that is when you qualify. And for ALS, you just have to be diagnosed with ALS, and you can contact Social Security Administration, and they can get you enrolled into Medicare. So remember, for some people, it is automatic. For other people, it's not. It just depends on what your situation is. So what are your employees' responsibility when it comes for paying for Medicare? None of this should look unfamiliar because these are going to be what they're already responsible for within an employer-sponsored healthcare plan. So you have your monthly premiums, deductibles, co-insurance, and co-payments. So what is not covered? Hearing, dental, and vision is not covered. And a lot of people are really shocked by that because as we age, hearing, dental, and vision become all the more important. And also, long-term care is not covered. And it's really important to note that under Part A, that you'll hear a term called skilled nursing facility. Also, you may see it abbreviated as SNF, SNF. And just because it has the word nursing in it, I don't want you to think that that is a nursing home. That is very two different things. A skilled nursing facility is for someone who is maybe they had an accident and they need to go to a rehab facility for a while to get back into it. And so that is what a skilled nursing facility is versus long-term care, which is going to be that nursing home care. So different parts of Medicare. Part A is going to be your hospital insurance. It's going to be your inpatient hospital care, some hospice and home health care, and skilled nursing facility care. And that is exactly what we're talking about with the skilled nursing or the SNF. And it's really important to know for a skilled nursing, you have to be admitted to a hospital as inpatient for 3 nights, or you may hear referred to as 3 moons. If you're not inpatient, are administered to the hospital, you can be in observation mode for quite a while, then you would not qualify to go to a skilled nursing facility. Also, your doctor had to prescribe that to you or recommend for you to go. So there are some qualifications that you have to meet in order for it to be covered. So typically there's no premium for Part A. We pay that Medicare tax, and it takes about 10 years in order to qualify for a premium-free Part A. And so, for example, I'm 31. I think I've had my premium free Part A since I was 27. So it's nothing that should concern people. And say if you have a stay-at-home spouse situation, then you can draw off from a spouse's work history. And so the deductible for this current year is 1676. For next year, it'll be 1736. So it is going up slightly. And a deductible can be applied again for additional hospitalizations after 60 days. So, for example, New Year's Eve is coming up. If you go out on New Year's Eve, you're on your way home, it's New Year's Day technically now, and get into an accident, have to go to the hospital. So January 1st is going to be your first deductible. You go home a week later, February 1st comes around, you have to go back to the hospital. You are still within your 60 days, so you would not have to pay for another deductible. Now it's now April 1st. We are outside of those 60 days, and so you would have to pay a new deductible. Part B, this is going to be your medical insurance. And how I like to remember Part A versus Part B is if you put hospital and medical in alphabetical order, they coincide to their parts. So A, hospital, B, medical. These are going to be your doctor visits. So if you're going to see your primary care, this is what this would come out of. Outpatient hospital services, durable medical equipment. This is going to be wheelchair, walker, hospital beds, things along those lines, and Medicare approved preventative services. Medicare offers a long list of Medicare approved preventative services. They include cancer screening, diabetes classes, STI screenings, cancer screening. I'm not sure if I said that one yet. And so there's a whole lot of Medicare approved preventative services. Most are available at no cost, but some of them may have a small fee associated with it. So for this current year, the Part B premium is $185. For next year, it is going up to $202.90. This is a few dollars cheaper than what the estimated price was, so I guess we can be thankful for that. Um, those who have premium that are higher income will have to pay will have to pay more money. So for that year, that income threshold is 106,000 to 112,000. But for next year, it does go up to 109,000 to 118,000. So that is something that to keep in mind. And also there is an annual deductible that is associated. And the deductible for next year is for this year is 257, and for next year it is, sorry, I have the document up from CMS to make sure I get you the right prices. It is $283 for next year. And so that also goes up. And so with Part B, there is a 20% coinsurance that he would be responsible for. So as you remember, Part B, those are your primary care visits. So if you were to, after you pay your deductible of 257 or 283 for next year, then you would be responsible for 20% for most services. So next we have Medicare Advantage plans. This is what you see all those commercials for. So when you see Jimmy J.J. Walker from Good Times, this is what he's talking about on those commercials. They are an alternative to original Medicare, which is Part A and Part B. And in this day and age, we love a good bundle deal. We bundle our phone, internet, streaming services are now bundled together. And that is exactly what Part C or Medicare Advantage plan does. It bundles your Part A, your Part B, and most of the time your Part D. And your Part D is your prescription medications into one comprehensive plan. And I think for some people, a Medicare Advantage plan can feel very comfortable, can very feel familiar because they're structured with your HMOs and your PPOs. So they're going to feel very similar to what your employer-sponsored healthcare is going to look like. And unlike with original Medicare, which is just administered through the federal government, these plans are offered by private insurance companies. And it could limit a person's ability to purchase a Medigap in the future. So how does it work? As you are probably aware, even if you don't know all the ins and outs of an HMO and PPO, you do know you have to deal within a network. So you must live in the plan service area and use the plan's providers in the plan network. You may have to pay an additional premium, though there's are several Medicare Advantage plans with a zero $0 premium. You may have to follow insurance company rules such as requiring a referral to see a specialist. So Part D. Part D is a fairly new plan or a part to the Medicare system. Medicare became into law 60 years ago this year, 1965. And next year in 2026 will be the 20th anniversary of a Part D plan. And so it helped cover the cost of prescription drugs that you pick up at the pharmacy. And just like with a Part D plan, Part C plan, I'm sorry, your Medicare Advantage plans, these are also administered through Medicare approved private insurance companies. And the really interesting thing about Part D plan is that it is optional technically. And why I say optional technically is because if you do not sign up when you're first eligible for Medicare, unless you're working, and we'll go over those kind of exceptions a little later on, you would have to pay a penalty. So optional, but if you don't sign up when you're first eligible, you're gonna have that penalty. So people who enroll in a Part D plan may have to pay monthly premiums, co-payments, or co-insurance annual deductible up to $590 for this year. And people with higher incomes may have to pay a higher Part D premium, very similar to the rules for Part B as in boy. So this chart kind of illustrates what your options are. You can do the original Medicare, which is in Part A and Part B, and you're probably going to want to pick up a Part D plan in the Black area, or you can combine it all into the Medicare Advantage plan. So original Medicare is a fee for service and includes Part A and Part B. And the great thing with original Medicare and why a lot of people like it is you can go to any provider that accepts Medicare. You can choose and join a Medicare prescription drug plan for drug coverage. Next, we have Medigap coverage. And this is going to be a supplemental insurance company or policy. And it really does exactly what the name suggests. It helps fills in the gaps or supplement in some of the areas cost-wise that original Medicare does not cover. It's really also important to note that you cannot have a Medigap plan and a Medicare Advantage plan. That actually happened to my grandma. She has always been enrolled into a Medigap plan. Someone called her, took advantage of her age, and said, "Hey, I'm going to sign you up for this Medicare Advantage plan." And so she calls me and said that this happened. I said, "Oh no, that's illegal. They cannot do that." And we got her switched back. And so since it does not work with the Medicare Advantage plan, you can already gather that it covers the gaps for original Medicare, like deductible, co-insurance, and co-payment. And there's up to 8 standardized plans that you can choose from. So there are plans from A to N. And please do not get Plan A and Part A confused. They're very different things. Anytime you see a plan, you can know that we're talking about a Medigap plan. So you can buy a policy within the first 6 months of enrolling into Medicare. You have to buy or pay for a monthly premium. It does not cover areas such as prescription drug costs or additional services like hearing, dental, and vision. And it's really and why it's so important to buy within that first 6 months of enrolling in Part B is because if you wait for any time longer than that, then you will have to go through underwriting or they'll look at your health history to determine if you are eligible for to be in that plan. And they may accept you into that plan, but you may have to pay a higher premium than you would have if you didn't have to go through underwriting. Now, some states, Medicaps are actually regulated more at the state level. And so there are going to be state-specific rules that kind of help navigate that. For example, say you miss your first 6 months, you enroll in a plan, but you live in Missouri. And in Missouri, you can, during your anniversary month, which is the month of and the month after, I believe, that you sign up for a Medigap plan, you can shop around and go to a different plan within the same letter. And at that point in time, you wouldn't be subject to underwriting. So your premium could actually go down. And other states have similar rules that can help you kind of navigate. But like I said, that is different from state to state. Medicare and the Inflation Reduction Act, or IRA. So you may have heard insulin now is covered by your Part D plan at $35 per month. This is a great thing that has happened. This, as someone who has counseled people one-on-one, insulin was always where we had problem in finding an affordable plan for people. That and inhalers. Um, and so it's also important to note, though, that not every insurance company will cover every single insulin. So when are looking at a Part D plan, it is really important that you put in the right insulin that you have, or if you're some reason are in a plan that does not cover the insulin that your doctor provided, go to the formulary or look at the medicines that are covered by your insurance plan and tell your doctor, hey, these are the list of insulins that my insurance company covers. Could I perhaps switch to one of these? You now have access to recommended adult vaccines without cost sharing, and there is a yearly cap for you. Even if you don't know too much about Medicare, I feel like a lot of people have heard about the donut hole and how terrible of a thing the donut hole is. Well, the donut hole no longer exists, and there's now for this current year a $2,000 out-of-pocket cap of your medications. Next year, it will go up to 2,100. And not only is there a 2,000 or $2,100 cap on out-of-pocket prescription drugs within Medicare, you can now spread that out throughout the entire calendar year. Say you have a medication that is very costly, and you would reach that $2,000 within the first 4 months of the year. There's now a formula in place that will spread out that cost for the entire year, so you can have a little more freedom and flexibility with your finances. That is something that you have to enroll in. If you are already enrolled in that plan for 2025, then you're automatically enrolled again in 2026. And then also there's the expansion of the low income subsidy. You may hear it referred to as LIS or extra help, which is administered through the Social Security Administration under Part D to increase um, those who qualify to 150% of the federal poverty level starting in 2024. So when do employees need to enroll into Medicare? So there are a few different options that they have during their initial enrollment. So when they first become eligible, at age 65 for most people that you're probably working with. There's also the special enrollment, and then there's an open enrollment. So an initial enrollment is for those who are new to Medicare, and the same 7 month period qualifies for whether you're aging into at 65 or if you have a disability. Think of that 25th month if you're on disability as your birth month. So if employees are receiving Social Security, they're automatically enrolled at 65. That shouldn't be anything new to you. But you have a 7 month period. You have 3 months before your birth month, and 3 months after. And like I said, think of that 25th month for those who are on disability as their birth month. The one caveat to that is if you're born on the first. I always love to use my Uncle Charlie as the example. He's born on June 1st. And so instead of his birth month being June, his birth month is now May in the Medicare eyes. And so that moves up his whole enrollment period a month. And there are late enrollment if your penalties that will then increase your Part B and your Part D premium. So it's really important to be on top of your enrollment periods. Special enrollment for employees who do not enroll in Medicare when they're first eligible, they can enroll during a special enrollment period. And this is for anyone who truly is losing coverage, right? And this is whether they lose the coverage through themselves working or a spouse. And so over the age 65 here, and so this is the time that they can enroll into it. And they have an 8 month period that in order they can do that for. Open enrollment just ended. This is, if you work in the Medicare space, this is the busiest time of year. It's October 15th through December 7th. It is the same exact time every single year. It doesn't matter which day of the week that they fall on. And this is for people who are already enrolled into Medicare. And so during this time, a person who has a Part D plan can elect to stay within that plan, go to a different Part D plan, or go to a Medicare Advantage plan. And the same thing is correct in the reverse. So they have a Medicare Advantage plan, they can go stay with that Medicare Advantage plan, go to a different Medicare Advantage plan, or switch to a original Medicare and pick up a Part D plan. Remember, if you switch, it could be hard to get get a Medigap plan at that time. Also, if you have Part D plan, you switch to a Medicare Advantage plan, make sure you don't have a Medigap plan in place. And Medicare eligible employees are not allowed to join during this time. And so you might be thinking, so what happens if I miss my initial enrollment period, miss my special enrollment period? When do I sign up? There's a thing called the general enrollment period, which is January through March. And so during that time, if they miss all those enrollment periods, they can sign up and get everything aligned at that time. So Part A, penalties. So if you didn't sign up when you're first eligible, there's up to a 10% penalty for the twice number of years that you didn't sign up. So for example, if you didn't sign up for 2 years, you would have that Part A penalty for 10 years. Or I'm sorry, that was terrible math I just did. If you didn't sign up for 2 years, you have that penalty for 4 years. I got the 10% stuck in my head. Now, Part B and Part D are going to stick with you for a little bit longer, by a little bit longer, for as long as you're alive, for the most part. So Part B is for every 12-month period you do not sign up, you have to pay a 10% increase for other your monthly premiums. And the key word there is truly every 12 months. Because sometimes, we like to round up, say, oh, it's been 11 months. That's a year. No, it's not. So it's every 12 months you go uncovered. And Part D, as you may recall, as I said, it is optional, but you're going to have to pay that penalty if you do not sign up. And so, unlike Part A and Part B, which is just 10%, and it's for every 12 months you go uncovered, Part D is every month you go uncovered. And so you would have to pay 1% of the national base beneficiary premium for this current year is $36.78. You would have to pay 1% penalty for every month you go uncovered. A great example, when I was counseling people one-on-one, I believe this was back in 2018, I was counseling someone and they never signed up for a Part D plan. So from 2006 to 2018, they never signed up for a Part D plan. So that here in Missouri, everyone was signing up for a $15 WellCare plan. It was very well, it just mean a lot of people needs. And so I said, so this is the plan that would be could be you would could enroll in. It's $15. It covers all the medication that you covered, but we're going to have to give you 144% penalty on top of that, right? And so if her penalty was more than what the plan would actually cost. And so the only way that a person can get out of having a penalty for the rest of their lives is if they qualify for an assistance program. So we were talking about what the Inflation Reduction Act is. So we talked about the LIS program. So they qualify for LIS. And there's another program called Medicare Savings Program, which is housed within the state Medicaid office. And then also the full-blown Medicaid. If they qualify for any of those assistance programs, then their penalty will be wiped. And say if they start making more money and they no longer qualify for those assistance programs, those penalties will be wiped and they will not have to pay. Medicare in your business. So depending on the size of your organization, will depend on what rules your employees will have to follow. So if you have fewer than 20 employees, or what is determined as a small employee or employer, your employees must enroll into Medicare. In a small employer, Medicare becomes the primary insurance company and work-based coverage become the secondary. The one caveat to that is if you are in a group health plan, and if someone within that group health plan is considered a large employee, then you can follow that rule. So if you have more than 20, then your employees have a lot more flexibility. They can decide to do a hybrid approach. They can keep their coverage through their employer and delay their enrollment, or they can go ahead and delay or enroll and have both coverage. But in a large employer situation, Medicare will become secondary. So small will become primary, large, secondary. So these are all the situations that your employees could be in. As we know, small employers enroll in Part A and Part B unless they qualify for a large employer due to a group health plan. And if that's the case, then large employers, your employees can enroll in Part A and Part B during their initial enrollment. They can decide to enroll in just in Part A and delay their Part B enrollment. And this is what a lot of people do if they're still working, just because we know most people have a premium free Part A. And then, or they can delay their Part A and Part B enrollment, and then they'll qualify for a special enrollment. So this is just a really great timeline of when your employees should start receiving information from um, Social Security, who oversees enrollment into Medicare, and then when they start maybe getting some advertisements and different things, and when it's really crunch time for them to decide what they want to do. So engaging your employees on Medicare, make sure that you are communicating with a clear and consistent communication. Refer employees to trusted and reputable sources and educate them on about Medicare prior to their eligibility. And the really great thing is, if you ever need a presentation, you know where you can get a free one right here. So different resources. Medicare.gov is a resource that you can have. You can create an account on there. And this is also where you can sign up for Medicare, sign up for like a Medicare Advantage plan or a Part D plan. If you need to sign up for like Medicare initially, then that is through the Social Security Administration. And so if you need to call Medicare, you can call them at 1-800 Medicare. That is what those numbers translates to. So that's pretty easy to remember, 1-800 Medicare, or go on the website. If you create an account, like I say, you can sign up for Part D or Medicare Advantage plans. You can see some of your billing information. If they have a person were to lose their red, white, and blue Medicare card, they can also request a new one or they can download one off from the site. Medicare Rights Center is a great nonprofit organization that can assist and provide really credible information. And also, we have the State Health Insurance Assistance Program, which is a free and unbiased Medicare resource that is funded through a federal grant. And this is actually how I got my start in the Medicare world, is working at the SHIP in Missouri. And so every SHIP is going to have a slightly different name. Um, like Shine is Florida, OSHIC OSHIP is Ohio. SHIC is Kansas. Um, as you can tell, I remember the ones that have unique sounding names. Um, and so they all have different names, but they all do the same great quality work. And so these people can actively enroll you into a Medicare Advantage plan, a Part D plan. They can enroll you when you're first eligible and get you signed up for Medicare through the Social Security Administration. Not only that, if you need to file an appeal for some reason, they'll assist you with that. And also, they're also going to screen you to make sure that you don't see if you qualify for an assistance program, and they'll help you with that application as well. Really great resource. Cannot highlight their praise enough. Next, we have the AARP's Medicare landing page, and this page has seen a really great transformation throughout this year. We had three Medicare tools, and in this year we decided to combine all three tools into one comprehensive learning experience for consumers, and that all that will just be housed on the Medicare landing page. So it'll ask, you can see where if you're new to Medicare, if you're someone with Medicare, you can kind of go through those channels and see things that you need to learn. There's also now an AI chat box called Ask AARP. So if you need to have a quick question, you can go and ask the chat box, ask AARP, and you can get a quick answer. It will also link you to the articles that they pull the source from. And we have been going through to make sure all the articles are up to date this year, so do not worry. So another really great resource that we now have is we have this new learning experience called AARP Navigator. And on there, a person can answer a few questions and then they'll get a self-designed course to figure out where they're at in their Medicare journey. So this one highlights the Medicare initial enrollment. But since then, we have launched two more courses, and we have one called Making the Most of Medicare for those who are already on Medicare and just need to maximize their cost and coverage for their Medicare plans. And we launched one in October, our third one in October, for Medicare open enrollment. These courses have a very good feedback. People have really liked them. And the really great thing is not only do we have courses within Medicare, we also have courses within maximizing your retirements and job search that are now both live as well. And next year, we'll be launching courses in caregiving. And so this is a really great resource. It is only available to an AARP member at this time. And so you do have to become a member, but these courses are well worth the cost. And then also we have our Employer Resource Center. And this is where you can see a ton of resources, not only in the Medicare world, but in other resource areas too. And so you just have to type in Medicare in the field, and then the Medicare resources will pop up. And we also have this new AARP infographics page. And so we have, I think, about 15 infographics up there now, ranging on different topics within Medicare. So if you need a resource for to give to your employees, this is a really great tool to just to know, get some Medicare basics and go a deeper dive into Medicare. And the really great thing is too, not only is it available in English, it's also available in Chinese and Spanish. Okay, and so that will be the conclusion of our presentation for today. As you can see, Original Medicare is your Part A and Part B, and you're going to most likely pick up a Part D plan, and the alternative being Medicare Advantage plans. They cover a large range of topics. Everything that Original Medicare covers, Medicare Advantage plan has to cover, but they also may cover more as well. Educating your employees is crucial and vital for they can make the right Medicare decision, because if they make the wrong one, it can stick with them for a lifetime. And you now have access and knowledge of resources and tools that are available for your employees. And so I think we're going to launch a poll at this point in time.
Yes, we are. Thank you, Xavier, for the great information. We're going to launch this poll for the attendees who are tuning in live. And while we are waiting for your inputs here, we have two questions in the Q&A. And please do make sure to use the Q&A function if you have a question during this webinar. We have a question from Fioma, who asks, does the yearly cap apply if you're enrolled in Part C?
Yes, it does. But
It's
remember, we're only talking about the prescription coverage. So do not get that yearly cap confused with your out-of-pocket max for the health plan in general.
Appreciate that, Xavier. I also saw another person, they had raised their hand. If you wouldn't mind, please using the Q&A function for your question. You're welcome, Fioma. If you wouldn't mind using that for use the Q&A for any questions you have. Unfortunately, we're not able to unmute you to ask live. And while we're waiting on that other question to come in, Xavier, we see this all the time, but what are some of the biggest misconceptions or assumptions that employers make about Medicare enrollment?
Yeah, I think the role, how important of a role that they should play in making sure that they get credible information. Because we know that there's a lot of misinformation. We know some people are just going to send you information so they can kind of sell you something. But we know Medicare and healthcare coverage in general is so personalized and something that is so vital that you get correct. And so it's really important that the employer play that kind of middle ground and that middleman for they can get that information out there in a in both a timely manner, but you're also a credible source coming from, being the employer.
I appreciate you saying that. And as we know, small businesses are the backbone of the economy. You all tuning in today are one of the more trusted sources of information, especially owning your own businesses. Um, for those who are tuned in live stream and who may or may not have heard this, Xavier, is AARP a resource if I'm a small business owner and I'd like to run a session during open enrollment? Am I okay to reach out and request someone from AARP to conduct that session?
Yes, yes. So if you ever need um a presentation on Medicare, I am more than willing. It will be me who will be giving your presentation. I am more than willing to do a presentation for your employees. And the really great thing is I'm free. I'm cheap. And so so not only can we give you like a great presentation, but it's also free.
Love it. I love that it's free. So please do use AARP as a resource. Xavier specifically is more than happy to come to your organization and answer any questions directly with you and your team. I know that we had another question. However, Maria, I can't see your question, so if you want to go ahead and place that in the Q&A function. Otherwise, we are more than happy to answer that for you over email. Uh, this session is the final series of 2025. So we thank you all for joining in with us. As I mentioned at the top of the call, we will be sharing these. Yes, Fiona, there we will share the recording. The recording will include the slides and all of the information that Xavier ran through today. So no need to remember everything off the top of your head. We should get that recap out to you by next week before the year ends. So we want to thank you all for tuning in today. We are wishing you a happy holidays and a happy new year. And again, thank you, Xavier, for your time and the informative information.
Yes, thank you. I hope everyone has a great rest of their day.
Thanks all.